And from Cape Coast, we head to Kumasi, where head of psychiatry units at the Komfo-Anokye Teaching Hospital is making a strong case for the decriminalization of suicide in the country. Dr. Ruth Owusu-Entwi says arrest and prosecution of persons who attempt suicide do not deter and prevent such acts, but rather encourage the act. She says research conducted at the Kumasi Central Prisons has revealed victims who attempted suicide and are spending time at the prisons tried several times to end their lives. Dr. Owusu-Entwi wants the state to introduce suicide-friendly policies, including provision of psychosocial support to victims to deal with the menace. She's been speaking at the World Suicide Prevention Day organized by the Ashanti Regional Health Directorate. Ohiming Terry of our health desk is at the event and joins us live with more. Ohiming, tell us more about what Dr. Ruth Entwi has been saying.
Thank you, Mama V. Dr. Ruth Entwi has been hammering on the fact that suicide shouldn't be criminalized. People who attempt suicide, for instance, should have the opportunity to live again. And then the life that she talks about is the fact that they should be supported so that they can overcome all the circumstances that force them to go into those thoughts. And then she also been hammering on the fact that society frowns on suicide. So society tends to stigmatize people who have suicidal thoughts or one way or the other attempted committing suicide. She brought in the bit about unpublished research conducted at the Kumasi Central Prisons, where people who attempted suicide and they are being, incarcerated, did not prevent them from doing so, but they are still, attempted committing the act. Let's find out from Dr. Ruth Owusu-Entwi on what she meant by decriminalization of suicide. Doc, help us understand this unpublished research that you mentioned today.
Thank you very much. I'm glad that to mark World Suicide Prevention Day, Joy News Multimedia has joined in the forces. I applaud you for that. Now, this data we collected, we just collected an unofficial data. It's not published, and this was in connection with these inter-university debates that we ran. We've run it for about 7 years now. Because of COVID, it's come on hold. And one of the years, the theme for the debate was on suicide prevention. And that is when our students from KNUST Medical School went into the prisons to try and get some data. And the information they got from inmates who were there for several crimes, not just for suicide attempt, for several crimes, we realized that those in the prisons, on the average, had attempted suicide 9 times. And that was used to buttress our point that it is high time to decriminalize suicide attempt. Because guess what? Those who are in suicide, of course, not just for suicide attempt, but for other reasons, have had the opportunity to even attempt whilst in suicide. So criminalizing the suicide attempt does not serve as a deterrent. You may as well put someone behind bars or imprison someone because of suicide attempt, and the person will still go on and want to end their life. Because research, several research around the world have proven that suicide attempts usually have underlying untreated medical conditions. And so why would you want to punish someone who is going through or battling a mental health problem or battling one trauma or the other? You will end up pushing the person to actually complete it. And once it is a criminal offense, it also prevents health workers and researchers to get accurate data that will inform policy change, because nobody will openly admit that I have attempted suicide because they know the consequences. And so we are unable to get accurate data to be able to inform policy change. And I think that if suicide attempt will be decriminalized, we would be able to send help to many people who are suffering in silence and bring these figures that are currently soaring in the country, especially in Ashanti region, to the barest minimum.
Okay. So, Doc, let's talk about the fact that in the Ashanti region, between January and June, the region has recorded 13 attempted suicides, 63 attempted suicide and 13 successful committed suicide in the region. People or persons with suicidal thoughts, what kind of support is available for such people in the region?
Currently, we have just one specialist psychiatric unit in the region, which is located in Komfanoche Teaching Hospital. That is where I work as a psychiatrist. And I think that for a region as large as Komfanoche, Ashanti region, our unit is too small to offer all the help. We do our best. Until recently, we had just one clinical psychologist working in the department, but having sought for increased numbers in our clinical psychology staff, our CEO and the hospital management have been able to push and giving us more clinical psychologists to help. But there is still another problem of space. I quite recall when some time back, a patient came to our unit who was critically ill, was going through a lot of psychotic episode, needed admission, but all our 11 beds were fully occupied and everybody on the bed was critically ill, needed admission. And so we had to let this patient go home with a caution to the relatives to keep an eye on her. The following day, this person jumped from the 3rd floor and killed himself. And imagine if we had had space for this person on the ward, they would have gotten the right kind of help and we could have saved just his life. We could have saved his life. And so we have been pushing for an expansion of our unit. We currently serve the entire Middle Belt, Northern Belt, Northern region, Upper East, Upper West. Most people still come down to our unit for help. And we have said over and over again that 11 beds are simply inadequate to cater for the numbers we see. At the OPD alone, we see over 15,000 cases a year. And if just 15 of them can be admitted when they get to critical cases, then I'm not surprised at the soaring numbers of suicide we are seeing in the region.
All right, Mama V, that has been Dr. Ruth Owusu-Antwi, Head of Psychiatry Unit at Komfanoche, throwing more light on what can be done to prevent a suicide in the Ashanti region.
And that's Ohime Interior, a member of our health desk, live there from Kumasi on World Suicide Day. Let's now talk about the classroom projects.